Hi guys, and welcome to bandaging. We have already talked about direct pressure and indirect pressure, but what about those injuries where we are not focusing on stopping the bleeding? That's where bandaging comes in. The purpose of bandaging is to prevent an infection and to absorb the bleeding. And the main principles of bandaging is to first clean and disinfect the area before bandaging it. Then we want to bandage it without applying any pressure. Again, with bandaging, we're not trying to stop the bleeding. And lastly, we want to seal the sides of the bandage to make sure that no dirt or nothing will get inside and that it will keep our patient from an infection. Now keep in mind, when you are bandaging, it's very important to improvise. There's a million different body parts that you can bandage in a million different ways, and we obviously can't cover them all. So remember this. When I was in the army, we had a saying, a good medic is a good improviser. And I want you guys to be good improvisers as well. Okay, but I do have some situations that I think are worthy mentioning here that you should know instead of just improvising it. And we will start with eye injury. If a person gets injured in his eye, then it is very important to bandage both eyes. At the end of the day, when it comes to the eyes, they are in sync with each other. And so, if our patient is injured in one eye and we don't bandage the other one and he will move it, then he will hurt himself. So, if we're bandaging one eye, we have to make sure that we bandage both of them. Next is a fragment. What do we do if there is a fragment stuck inside of our patient? In that case, it is important that we make sure not to pull out the fragment. We want to make sure it stays in place and we want to avoid an infection by just bandaging around it. We will never take out a fragment outside of our patient. That is the doctor's job. Okay, next, what do we do if there is an exposed tissue? What happens if our patient has his guts exposed, for example? Well, in that case, we want to make sure that we first clean the area. So we can use water, but it is even better if we have some sort of sterilized fluid that we can use. And after we cleaned it, all we want to do is to very loosely bandage it in place. Now, in case of an amputation or times where you need to use a tourniquet, then you obviously want to use a tourniquet as we learned before. You place it 4 fingers above the injury and you write the hour and you do everything. However, after placing a tourniquet, you still have some time to wait until the ambulance arrives. So it would be a good idea to also bandage the area of the injury. So for example, if someone has an amputation and you put on a tourniquet, then it would be a good idea to bandage the main injury as well. And lastly, chest and stomach injuries. This one is a bit tricky. It is very important that we don't bandage chest injuries, okay? And I think this should also include the upper back. And this is quite a complicated explanation, but I will do my best. Basically, our lungs, they have a thin layer that is covering it. It's called the lungs pleura. Now, what happens is if a person gets injured in his chest and it goes all the way to his lungs, and we bandage that area, then what happens is that when we take air inside, we're filling this thin layer with air, and the air can't come out because we sealed the hole in the chest. And what happens is with time, it creates more and more and more pressure, and our lung can get collapsed because of that. So it is very important that we will never bandage any chest injuries to not create this situation. Also, if there is an injury in the stomach that we think might have gone all the way to the chest, like a fragment, then we will also not bandage it. However, I do recommend that if it is a lower stomach or lower back injury, in that case, I do recommend that you will bandage it. However, don't apply direct pressure. You're just trying to bandage it so it will not get affected. Okay, and that is basically it. Now remember, there's going to be a lot different situations where you need to bandage. Luckily, most situations that you need to bandage is just using little band-aids. And I hope that it will keep it that way. However, it's always important to remember those things. I hope you guys are now more confident about bandaging and about treating people. In the next section, we're going to cover how to treat trauma injuries. We're going to cover the trauma treatment scheme. I hope you guys are excited and you're having fun, and I'll see you in the next lesson. Bye, guys.